Not me.
I think I got it.
If you'd like to get started, you can. I'm just gonna bring up the analytics and get that done. So.
Person close.
Health Committee, waiting for.
We have a lot of contract amendments for all our providers. The state with the budget gave a 5.4% COLA. And then a couple of them got an wage increase, so all of the contracts have to be increased. So our first one is to amend resolution 21-546 for the ARC flow. Their contract is going to be $59,068, an increase of $2,719 from the contract. And I want me to just go through all of them. Okay. Second one is to amend resolution 22-15 for Camp Getaway. Their increase was $5,488 for the new contract, $141 working dollars. Number 3 is for, do you need me to read all the resolution numbers and everything? Okay. Was for Hillside Children's Center, the increase of $4,918 for their contract. And then number 4 is for Living Opportunity for Paul. They had obviously the owners of one that's $14,027 increase for a COLA. The state is they did try to increase supportive housing funding because they know that that's been stagnant for a while. Number 5 was for Peers Together Wyoming County. They had the COLA and minimum wage adjustment for an increase of $16,422 over their original contract. Number 6 is to amend Spectrum Services contract. We're amending an amendment because we increased their contract for OASIS funding. This is now on the OMH side for COLA. So they're just going up $20,905. And then the last one is an environmental agreement contract with the hospital behavioral health unit. They do behavioral health unit and the forensic services in our jail. Their increase is $7,599 from the previous contract.
Okay, any questions on?
Did they just automatically send you that? Did you have to apply for all that?
For the COLAs, the state aid automatically increases, and then we just have to go through each program line and make those changes. These are all programs that are like that the Office of Mental Health specifically follow, and we have to report on.
I'll move 1 through 7.
1 through 7 are being moved by Supervisor Brick. Very further discussion. All in favor?
Aye.
Opposed? Carried. We have an appropriation.
Yep, and these are all the appropriations to accompany all of these COLAs. So, and 10, 11, 12, they're all, it's based upon the funding. That's how, for each service.
Thank you, that's all right.
Yeah. Any question on page 12?
Sure.
I have a motion by Supervisor Brick. Discussion, all in favor?
Aye.
Opposed? Yeah.
That's all I have.
4 pages. Take one.
No, it did not take long. I am just updated that we are meeting with community action today to discuss a little further about the opioid treatment program. Did get the proposal from Erie County Community Action, and we're going to go forward with you know, that it will be a site review and, you know, community service report, so. I don't know if there's questions on that, but it's opioid treatment program, that's the normal OTP use, that's methadone. So the proposal was pretty vague of what they put in, it, you know, included the Genesee or Wyoming County. I do know that they were out last week to actually look at the facility to see if it would actually work for what they need to do. We'll see what the proposal is, and go from there. It would be 100, it's 100 slots that they were applying for methadone. They feel that there's a need that they have a wait list from what they're seeing in Erie County. We do know that individuals go to Rochester as well. So it is very regulated, and you know that there's a lot of safety measures put into that as well.
What do you feel for how many current methadone clients we have? I mean, how many in Rochester? I mean, I've seen a few.
I don't have that information. There's no, you know, there's no way to know. They report in their application that they have individuals that are on a wait list, and that the majority, well, it was written for Genesee and Wyoming County, so it's hard to tell what specifically. And I also know that Community Action has mentioned that they have provided transportation for people to get to Rochester for them. So we know that there's at least a handful of individuals.
Sure.
I think what they find is that more people will take advantage of it when it is local and, you know, easier to access. So, you know, I would think that there are people.
Yeah, I think so.
And we also know Livingston and Allegheny County don't have a methadone treatment provider either, so we could even draw from those counties on here as well. So.
Another question, I noticed on East 28, we get in Gavin just before that, there's a big billboard up now that says, you know, if you have any addiction, or I don't know exactly what it says, but there's a big phone number on the bottom, it's 716 number. You know,
is it the yellow one that's like you take it to the box one, or?
no,
I haven't
it's
seen
just blue and white.
it. I have not seen that one yet.
No, it's not, take a picture of the hall, I know what it actually is.
I think
You need help, Doc?
I think it's going out that way today, so I'll pay attention. But I think usually what happens is like Erie County, there are entities in Erie County that get funding that cover our region.
Okay.
And that when they do billboards, they tell us that they can only do one billboard. And that's the one that goes up in all of the counties, and it'll have like the Erie County opioid task force number, which, you know, is somewhat frustrating because we have our task force and we do stuff, but.
Yeah, it's a little odd, it's almost like it's the kind of line
Yeah,
on top of it, so.
And we're not in the number.
Hmm.
We're not in the number.
Sure. It's not a question.
Yeah, I realize it's that the treatment is all voluntary. Is there talk or thought of this being forced in by law enforcement when they're, you know, arrested for issues?
Usually, I mean, like, for that, I mean, the treatment would be voluntary for that.
You can't force it.
If they're in treatment court, there's a little bit more weight to it, if they're appropriate for that program, but.
Anything else?
Thank you.
Good morning, everyone.
Good morning.
Okay, item one, the grant application.
So this is Kelly's comments, regarding Erie County was actually a good segue. This grant application came about in response to what's called the targeted RFA. So the Healthy Families Program is in existence in about half of the counties of New York State. It's an evidence-based program focusing on intense home support for lower socioeconomic families with children present. It's an early childhood program. So the targeted RFA inviting counties who don't currently have the program to file an application. So, always being interested in working cooperatively when we can. We shook the bushes a little bit, tried to develop an application with Genesee County, they declined. The only other application that I was aware of for Wyoming County was the Monroe one, out of the Rochester area, and it's not an organization that's well known to anyone, and I checked, well known to anyone in Wyoming County. And I started to have real concerns about, case management and deep early childhood care program being administered by a Monroe County provider. So we fell back and reached out to Community Action, who we already partnered with for the Navigator program very successfully, and elected to develop an application which has been funded. So this will be, if it's approved, the county and the health department is the contract holder, and the funds will be received by our department. We will hold responsibility for contract management and program management. And then the balance of the funds will be subcontracted to Community Action for program execution. So that's what's proposed. And we talked pretty carefully internally about pros and cons. Just because we should doesn't, just because we can doesn't mean we should. But in this particular case, we felt strongly enough that the program was important, and we had some deep concerns about it being administered by a rural county program. 5 years, 110,000.
Any questions?
What's the 110,000 do? Does it give direct payments to people?
So there is a component of that, these are families with a lot of pressures, and there is a small amount of those funds that have been reserved, and Community Action has volunteered to support this as well for diapers, if it comes to a critical incident, or medical supplies if they have needs that aren't being met by the current health insurance program. Most of it goes to fund home visitors. Okay, these are peer or community health type worker folks who will, work with social services and families that are on public assistance, gain referrals, and then go out, establish relationships, and go on regular home visits, talking about things like parenting, childhood milestones, literacy, social opportunities, things like that. So it's not a program that we have in the county. It's evidence-based and designed to improve families' outcomes and ultimately reduce the county's contributions towards public assistance going forward, generational poverty type things.
So how do they know how much it'll be for these services?
Yeah, I'll super let you know.
Is it run out of money or?
So they actually, it was driven because they tell us we know how many Medicaid births there are in the county in a year. They gave us a percentage estimating that 15 to 17% of those so I'm looking at it for validation. 15 to 17% of those families will end up participating in the program. That's how we know how many we can expect to have on caseload. The state gave us $7,200 for each one of those potential caseload counties. So we're going to have 2 home visitors, recognizing that referral generation is ongoing. It's not just a question of accepting a caseload right out the gate. When we have a new program, there's quite a bit of effort that goes with promoting the program, helping people understand it, with other community-based organizations for referrals.
So you have to hire these people or?
That's Community Action.
Community Action?
Yeah.
Come to them.
Yeah. And they've been a good partner for a safety net organization that, touches all over the place.
So there probably will be an educational requirement, certification requirement, something of that nature for the people that are going into the homes.
Oh, yes.
Okay,
The training expenses are part of the grant funding in year 1. And whenever we have a flat funded 5-year grant, we try to build in discretionary expenses in year 1 to deal with salary increases throughout the period of the grant. So OCFS, Office of Children and Family Services, who is the funder, has let us know that because of COVID, those trainings now occur largely by Zoom. So the time and expense in presenting for those trainings is built into the application.
Any other questions? Supervisor Grant. Any further discussion? Opposed? Carried.
Thank you. Next month, we will, in the intervening month, we will spend time finalizing the subcontract with community action, so that will come back next month. And we'll be able to provide a little more detail on who's committed to what and how to put the waste on.
Item 2.
It is so difficult to buy a vehicle these days. So I'd like to recognize Jess, who has worked hard with the ELC COVID funding folks at HRI to get approved 75% of the purchase of a full-size pickup truck. This would include a cabin and bed slide, right? We now have the weights and measures program, and that van is a 2011 reaching the end of its useful life, still roadworthy, but we're in low. And the other 25% of the purchase is out of budgeted weights and measures funds as part of the 2022 budget. And Jess, being pretty networked in the world, identified that there were some vehicles available that met our spec requirements. So Supervisor Davis gave us permission to generate a mini bid because dealers don't hold vehicles when they say, we'll be right with you in a month to pay for it. So the mini bid closed on Monday. There were 2 respondents. One of the bids came in significantly higher than we were prepared to pay. The lowest bid was WebSmart, and I don't have the address off the top of my head, but it is an online dealer that we've done business with in the past out of Rochester, I think, correct? And so they came in low bid at $47,884.99. 75% of that paid by grant funds, 25% paid by budgeted weights and measures funds, and then an additional $5,000 or so for the bed slide and the cab. Now, this is going to be multi-purpose. We actually have a trailer on campus right now, but we don't have anything to pull with. It's too big. And the weights and measures van, where we have to carry around calibrated weights and various equipment, is wearing out. So this feels like a potentially very good time to execute this purchase and improve the fleet for use across the program.
Just a half-ton pickup. 3/4.
So part of this supervisor work is related to the fact that the weights and measures program requires the department to load up all our stuff, a lot of weights and measures, and drive to Albany and leave the devices to have them calibrated, certified. And right now we don't have the means to do that reliably. We could take the 2011 van on the road, but very suitable for driving the highways and byways of Wyoming County, but I would not feel comfortable deploying staff through it.
Looks like it's one of the dogs. So.
Well, so, if y'all approve this, we'll talk about that in just a second. So, I did speak with Cheryl regarding the fact that the timing of this precluded us from knowing who the successful bidder was before 5 o'clock on Monday. So it is WebSmart. Just what is the name of the dealer?
It's WebSmart, Charlie, and
It's her.
You guys can
I want to say
email,
it is Western.
you can email all that to me.
Okay.
It's a
It'll be in minutes.
Okay, it's a vendor that we've used in the past. I hesitate to quote anything beyond WebSmart because I'm not positive, but we have used them in good faith and they've been a successful contract.
Western, you let us know.
Yeah.
Yes, I'll send it to you. I'll send it to you later today.
Any questions? Comments? Motions?
That.
Supervisor Roberts? There's no further discussion, all in favor?
Aye.
Opposed? Carried. Now we'll talk about number 3.
Yeah, so Justin did stop down to the, let me back up a little bit. I know animal control has expressed an interest in a second vehicle. They're very hard to come by, very expensive, just approve the transaction. And so Janice's budget suggested, we should call the health department to see what's through it. And so now that we have permission to execute this agreement, the weights and measures van can be declared surplus. when Justin came to the department on a day that I was actually off last week, and ended up with stars in her eyes over the white van, which is the water resource agency van that is not actually ours. So I asked her a couple of times what her interest is in the red van. Again, it is roadworthy. My impression is they're just going to be driving it around the county, regularly maintained by highway. And if the board would like to have the health department transferred to its measures, or transfer to animal control.
Brian, did you talk to Justin about this at all?
No, I said earlier. Which I think is a great idea, but maybe we kind of
Talk about it.
Well, so the other piece is the white man is not the health departments to do business with, unless the water resource agency. You know, I would say maybe the red one would be a stopgap until at some point the white one that the agency owns and controls becomes available. That's not us.
So the 2011 Ford van is the red van.
It's the red man. Technically maroon, but
Would it need any renovations for her to use it?
we've been driving it,
I
so.
mean, as far as, you know, she guys had opened, so she'd have to cage it or something.
There's actually a feature, there's a divider between passenger and car.
Or they could just get some dog crates and strap it into that, you know, if they had to pick up more than one dog.
I'll make that one minimal.
Yeah.
Any further discussion? A motion by Supervisor Badger. All in favor? Oh. Full service contract.
This is, so when I was describing the Healthy Families Program and an intent to subcontract community action, this is the Navigator program, health insurance enrollment. We've had it for 7 years now. Community, we subcontract with community action, again, to provide those health 1.5 FTE for that to hire people to go out and do enrollments. The health department has to push it. This is this year's subcontract for the Navigator.
Motion by Supervisor King. Any further discussion? All in favor?
Hi.
Oh. And we seem to be doing quite a lot for the community action.
So they
Kind of, it's kind of unknown from a lot of people.
I'm actually, under Rosie's leadership, I'm really encouraged by the work that they're doing. Their programs are, you know, thoughtfully identified and very well executed. They've been with me.
And if anybody doesn't know Rosie's part of it.
I didn't know.
Yes. I don't know if she officially announced it to the general public. She announced this to the board. So, but I can't remember the girl's name to replace her.
Is it Carrie Johnson?
I think so.
I think so. She's working with her right now. We've worked with her before.
They get a few more months.
So it's not. It's in Southwest. Yeah. Settling in up there. Working. Okay, let's go to item number 5.
So, after the veterans were coming yesterday, beautiful suite, and I hope they'll be very successful and comfortable there. And that has resulted in one end of our building, one end of the Munkers Mill building being vacant. And we have talked about an increase in state aid for 2022 as part of the New York State budget. Last month, the committee and the board gave us permission to appropriate those funds into our budget. In a 65,000 went to building renovations and then 10,000 for other expenses that were not budgeted. So, in the intervening month, we've had a meeting with, a couple meetings with buildings and grounds, talking about what our vision for the department is and trying to make sure it intersects with what the building can actually do. And then also with Devin from Highway came down to look at the parking lot. And Bill Sykes has been very attentive, helping us understand what options there are. We are not as attentive to security measures at the health department as we could be. So he helped us understand what those options are with regard to perimeter door locks and cameras on the exterior of the building. So all of those things are beginning to happen. Buildings and Grounds was very clear that because of other demands elsewhere in the county and some workforce issues inside the department, that they would have no difficulty procuring the needed materials in 2022 for us to pay for in 2022, which is a condition of having the funds available. But it was likely that the work would occur over the winter months when there were fewer outdoor projects to be attended to. We are agreeable and thankful that they're available to do that work for us. The piece that came in just in the last few days is a parking lot bid. Highway came down, did some milling and patching for us. And Mike Adamzak reached out following the procurement policy to acquire an estimate for the sealing and striping of the parking lot. And that did come in at $12,609.68 with Seal a Deal. My impression is that that's going to come through building Public Works, but I had not seen the agenda, so I thought it was important to mention it here so that the committee was aware and I need to generate a PO to that before. The work actually is scheduled, no pressure or anything, to be done this weekend, so. That would be great. So Cheryl, will that be approved then at public? Is it?
I was just trying to think where if I saw it on the agenda, but I'm still finalizing it, so I'll know not to look for it when I do.
I can send you an email just to trigger.
It might be good just to make sure I have a reminder, because I'm trying to find a couple pockets of time to finish the agendas for tomorrow.
Okay. I will do that as soon as we get back to the website and see what see which quick is. The name of the vendor that you find really funny.
That's one we've used.
Is-
If it's one local and it's one that we have used,
Okay.
Eagle.
So I trusted that Mike knew who to contact in order to get bids, who was reputable, and the timeline here is unbelievable. To get that work done that quickly is, that'd be nice to have that checked out the list. And so the expense will come out of the state aid that we received for this year. So we'll provide periodic updates as that work moves along. My impression is that Kristen will be coordinating the ordering of materials, create a spreadsheet, and then our office and fiscal and she will work together to make sure those the expenses are paid timely out of the funds we get. Thank you. And it'll be nice to have some space.
Okay,
Yeah, so this is a grant that crosses 2 years. And we had originally anticipated certain expenses to come, throughout the 12 months of the grant. And this year we get additional expenses. This is the fair rec grant, isn't it? Yes. So we talked a little bit about this. The state in their ultimate wisdom eventually instructed us to claim this expense. They approved it. Claim the expense out of the immunization grant. So that's why the expense is occurring this year as opposed to a future expense.
Thank you, and motion by Supervisor Britt. There's no further discussion, all in favor? Opposed? Carried. Under appropriation.
This is another grant that the health department received for vaccine response, COVID, and others. It's communicable disease vaccination, so it's got a little bit of a broader title. This one actually goes out to 2024 with just expenses that we've identified in the current year, and so these funds need to be appropriated now for those expenses. And the idea is to expend as much in a fairly linear fashion, so we don't hit the final quarter finish line with, significant funds that are unexpected.
Yeah, motion by Supervisor Green. There's no further discussion, all in favor?
Aye.
Opposed? We have a transfer, basic measures.
That's actually withdrawn. That was done by budget and it's actually titled incorrectly.
That's one Gina's talking about this morning. Okay, then we got some FYI contract.
So there are two. The first one is Sinclair Pharmacy. And Cheryl sort of forgot in response to your action on the contract. We don't have permission to execute, so I don't actually have an agreement to upload this as part of it. When the reproductive health center closed at the end of last year, the health department had to call back and figure the best and most effective way to ensure that we're meeting our public health law responsibility to provide STI testing and treatment for people at no cost, and that would be people who are uninsured or for confidentiality reasons may not want to have an EOB go to their house. And so I anticipate volume being very low, although our incidence of certain STIs in the community is pretty high right now. Chlamydia and syphilis, actually. So we have some work to do there. Rather than us ordering medications and becoming a dispensing pharmacy without knowing volume, we run the risk of getting stuck with a cabinet full of meds. And what we're going to do instead is, subject to your approval, is contract with Sinclair's, and this will only be for uninsured patients to, give them a prescription or send a prescription over to Sinclair's and send the patient over together. This is a legal responsibility of every health department. We used to do it through family planning. And the second one is Livingston County. We talked about this probably 3 or 4 months ago. Livingston County has difficulty with coroner coverage. And they reached out to me and started a dialogue about whether or not there would be willingness for the county and also the coroners to have a mutual aid. It's not a mutual aid. They were unwilling to make it bi-directional. So what they essentially want is, if none of their coroners are available, can they call dispatch and have one of our coroners paged out to take the case in Livingston County. Now, there's actually no money changing hands between the 2 counties proper. Rather, if one of the coroners in Wyoming County responds to Livingston County, they will be set up as a Livingston County vendor and paid directly. This agreement is really just to memorialize liability concerns, responsibilities, because the work at the scene is only part of the work. Sometimes the cases have to go to the medical examiner, the electronic death record has to be generated and followed up on, so we've reached the finish line. The coroners are agreeable. They're under no obligation to respond to Livingston County, it's simply if they're available and willing to do so. And Livingston County will pay them mileage plus $275 a case. Or we would be at 100. So there is actually a request for the compensation committee to consider one-time adjustments there. Not to the extent of $275, but it's documented in the request. That's this.
I can see somewhere that they called the county. One up there, correct. Okay. Operation Monthly.
I'm jumping ahead. Yeah, so vaccination efforts are ongoing, volume has been low, testing is still occurring, also volume has been relatively low. We are seeing a fair amount of illness in communities likely attributed to BA5. Hospitalizations are present but not expecting, is that correct?
Yeah, that's, we've seen that significant increase in the side. That's why.
So the BA5 variant, I understand that they are working on a vaccination to try to match the vaccine to the BA5 variant, but at the rate at which COVID virus is mutating, I question if we're quite there to the point by the time that vaccine gets at least an emergency authorization, BA5 might be included in there. We don't know that yet, so we're still watching. I don't for a second think we're going to skate through the fall winter without seeing a significant increase in cases. So we remain outbound, vigilant to answer questions and interact with the community and provide any kind of services to special populations like the farm workers or, the schools or whatnot.
Is it still required they wear a mask in a medical building?
In the hospitals, yes, in Article 28, so in private medical practices, I've seen some variation.
Yeah, in private medical practice, I don't think there's any.
But we're in Article 28 and we're bound to be masked during the
Hospitals.
yes, yes.
I was, for an eye doctor, and I had to wear a mask, which is really hard to look through the lenses as it's fogging up. And then a couple of weeks ago, I was in Erie County, Sterling Drive for a checkup on something. Not a person wearing a mask anywhere.
Yeah, it's very old to the practices. The eye doctors are typically right in your face and then doing their exam, so I think
My dentist was dressed like a good perform surgery on me when I was in there last time, right? It's right there. So June environmental health report and weights and measures.
We did have some post-exposure, human post-exposure prophylaxis happening in June. All cases where animals had captured be tested to determine if it was rather than not. So just stresses the importance of, if there is an encounter, we do our best to try to make sure we secure the animal. It's expensive and it's not pleasant for people to go through, so we're best there. We also sent myself and one of our technicians to, oh gosh, the name of the town escape. Oriskany Falls, that's it, for a drone training, which was pretty exciting. It was really, just nighttime flying and just some real skill development, which was great. So we were fortunate enough that Brian Myers was able to get us enrolled in that and took advantage of that. So we're putting those to use, we're getting the drones out and doing a lot of septic stuff. We're taking aerial photos of completed septic systems. We have documentation of where the system is, and we're going to try to push that a little further down the road as far as some software to actually geolocate it, so we can put it in our JS program. Amazing. So it's exciting stuff. And then as far as weights and measures, Mr. Hamilton has been busy. He's been doing a lot of fuel pumps and one-off scales, new scales for the summer months. He's actually at weights and measures school right now in surgeries. Very fortunate to be there. So, yeah. Good. Any questions or any reports?
So did you want to touch on children's camps and recreational campgrounds? I know that, the weather pattern has been odd and we're seeing some outcomes.
Yeah, we actually closed 2 bathing beaches in the last week for the harmful algal blooms. And we did have a reportable on Silver Lake as well. So it's why this is, all of a sudden happening so widespread. Not seeing good science on why and where and that sort of situation, but it's a difficulty that we're really struggling with. There's some anecdotal things. We've noticed, I noticed in the past that some ponds that were using the aquashade typically hadn't been experiencing the blooms like others. And the beach we closed yesterday had always used aquashade. well, we don't see the aqua shape net on this year, so, and they're not even moving. So again, this is really starting to click in my head that that's maybe something that could be a preventative measure in some of these, small ponds that people are using for recreational water. So again, more to be learned there, I'm sure, but just kind of weird that it's happening. Yeah, it's unfortunate because there's a lot of bee shades that are being lost in a hot summer. It's
Real quick, the concerns regarding the.
yeah, so there's the toxin that's involved with the actual harmful microsystem is the toxin of concern. And it's an ingesting thing, so if you ingest it, it can make you sick. The big concern is pests, dogs, and that would be going swimming in water, gas extinguishers, but they'll get on and they'll lick themselves and clean it, and they're ingesting large amounts of this the algae and the toxin that can actually kill the animal. So as far as humans, the exposures, you're usually not ingesting that much to be fatal, but it can make you sick.
Well, and I'll point out, kids are not really discerning when they're swimming around in ponds and so, smaller stature humans who are potentially ingesting pond water, which is real.
And it's also a skin irritant, you can have rashes and things that develop, so it's not something you really want to just dive into. So, yeah.
Early.
It's literally.
Has there been anything with the monkeypox out there? Are we doing, I see that they're doing vaccine clinics and stuff, and I didn't know if anybody had required it as here, so.
No, we have not had anybody that has required testing to this point. We have been working closely with our own staff in the hospital to be prepared for the inevitable phone call that comes in and says they have somebody that they need testing it. So we're ready to go.
Ready to go, but
And then basically it's just a matter of if there's a suspicious rash, we do a couple of samples and then they get sent to we're going to be working closely with the state to provide our own or private labs that are now doing online testing. And then basically nothing happens until the testing comes back. If it's positive, then we would potentially offer the person that has a treatment, which consists of oral antiviral medication. And then the state and us would get involved in contacts, which are close contacts, and they would be potentially eligible to receive the what is essentially a smallpox vaccine that we're using. That is also that.
We've had a handful of calls to the department seeking vaccine. We have not been allocated. We refer them to Evergreen, Erie County. We are aware that they're working closely with their health department to hold vaccination sessions for community members. We're ready.
Hopefully we don't need it.
I do not.
I have one item regarding the community health nurses. I believe everybody received a copy of the letter that was faxed to the board. And on the surface, it appears to be a huge. And community health nurses are not being paid for what hospital nurses are. And I talked to Dan about it yesterday, and he said, well, they do different jobs. Well, yes, they do, but they still have the same education, RNs and RNs and RN. So his answer was to that was, well, then they can go to the hospital.
Can I elaborate a little bit?
You can, just let me finish what I was, oh, I still have that train. One of the nurses is a jail nurse. If all three of these nurses decide to go to that hospital,
there's just no way we're gonna replace them at that base rate. It's a fact. One of them, like I said, is the jail nurse, and they're not beating down the doors to be a jail nurse. So I don't know, there's enough of us here, there's 10 of us on this committee. What we want to do about it, or do nothing about it, because on the surface, it is the union issue, where they didn't get the same pay for all the RNs in the company. But to be fair to our employees, I think we need to look at it. I think we have.
Question. I'm sorry, Laura, you have something to add to it, but I guess it would be a question for both of you. The hours that they work, are they the same as the hospital nurses?
It's a 40-hour work week,
A strict standard day?
40 hours. Generally speaking, those hours occur Monday to Friday during business hours. The jail nurses' hours are a little different because of the rhythm of the med passes and the CO cans and things. The two nurses that work at the health department work 8 to 4:30 Monday to Friday.
Jail nurse does take calls on the weekend.
So she's paid to be on call a chunk of time because inmate issues don't just occur during those 8 hours. When I think about the responsibilities of a nurse in the acute care setting in the hospital, okay, they're doing history, physical, the assessment piece. They're taking medication records. They are implementing a care plan that is very much similar to the work that Melissa does in the jail setting. Okay, so she actually is more similar to the acute care setting nurses or even a primary care setting. She works pretty autonomously, closely with the provider who's assigned to the jail. That's Sarah Schaefer under Dr. Collins' supervision. That is a demanding job. The inmates that are presenting have, in many cases, complex physical histories. They may have a lot of medication management to take care of, and very frequently there's substance use disorder and mental health issues. Melissa's job is a complicated job, very similar to the clinical work that an acute care RN would do. The other two nurses, all three of these individuals are very valued colleagues. When I started with the county, there were 8 public health nurses. And through attrition and redistribution of job duties and use of different titles, we have now come down to 2 of them. Pretty heavy lift, heavy responsibility for program administration there. This is communicable disease control, childhood lead poisoning, immunization grant. They do their work well, and I'm grateful for them. At no point have any of the 3 of them approached either myself or Dr. Collins. Yes, at its crux, I think it should have been adjudicated during the collective bargaining unit negotiations, but it wasn't. I've had Celeste visit before. She's very good and attentive to the work that she's doing, but there's a lot of it. And so, I didn't participate in the negotiations except to send an email to Dan and tell him what was on, the health department's wish list. But beyond that, we weren't involved. So yes, the differences are they're working Monday to Friday, but the hospital clinic, community clinic nurses are on the same pay scale as the acute RNs. They don't get to participate in the clinical ladder piece, but it's the same wage for much different work. So, it's kind of, it's multifactorial issue, truly. And what I don't know, because all of this is really pretty freshly emerging, is how much nurses in other health departments are making, or how much nurses in the Genesee County Jail or Orleans County Jail are making for similar work. I don't know that. I would like to know that before it goes any further, and I'm more than capable of finding out. But this just rose to my attention yesterday. So there are some options, direct it back to the union, which might result in attrition, which is so sad. Let me work with HR and the nurses to gather some information and bring it back for consideration or something else that you would prefer that we do.
It's basically the union.
We would have to reopen the union contract, I don't think.
So the hospital has utilized MOUs for particular titles in particular circumstances. So I don't know the mechanics of it, but I don't think reopening negotiations would be an
I was gonna
option.
say the same thing as Laura, because we have seen several of those independent MOUs
Some here.
address similar situations.
So, I'm supportive of my workforce. I also fully understand that, the hospital is bearing a crushing expense for agency nurses. But we would be in an extremely difficult situation if, so they're gonna be involved in this healthy families as well, right? If we suddenly found ourselves without nursing staff, it would be remarkably difficult for us to meet our grant obligations. So, complex landscape, there are some options for your consideration.
Can you talk about it, compensation committee meeting?
I don't think we have enough information though.
It misses,
I think
I would agree.
misses the deadline.
to make a decision for or against, we just don't have enough information at our hands.
So, at this point, if you were to direct me to work with them and gather some information, like I don't.
Right.
I don't have a request.
Not only that, but Jim, this is gonna be a negotiation with the union.
Right.
So
So
this is a standalone.
it is, because, your compensation committee only addresses SB&I.
So can I, yes, and can I add that depending on what the outcome is here, we have our clinical director our director of clinical and community services, who's, trying to make sure that the wage landscape of the health department is all pretty equitable. Depending on what the outcome is here, that title, I would expect will be presented to the compensation committee next year, potentially for 2024. I'm just sharing. Not a conversation for now, but I expect that to be a byproduct of whatever,
Right, so are they talking a big difference? We don't, like I said, we really don't know what, I don't know what scale it is either way.
So,
That's the kind of information, like, that we.
They're hourly, that's how they pay, hourly.
yes. So I think there's some frustration as well. They weren't aware of when the union contract was being voted on for ratification. There are no stewards, at least in the county, to be communicating with the workforce. Just because they didn't know, it doesn't excuse anyone from participation. I would say that go take the training, become a steward, be involved, right? I know what our collective responsibilities are as management as far as the bargaining agreement goes. This is a complicated issue. It's very, very in demand credential right now. And these are tested employees doing good work for us. I would like to show up for them, but it is off cycle at your discretion.
Well, I think the first thing we need is some comparisons as to what neighboring counties are paying their health department.
I will gather that. I will take a look at, so I actually cast this by email late last night with Kevin. It was not enough time. So Genesee, Orleans, probably the western region counties, and maybe, stretching up a little bit in central Sudan and Livingston, making sure that we're canvassing counties that are a similar size. And then I'll also color up some jails and see how much these nurses are making on an hourly basis. Because I think they're really two, separate conversations. Shall we report back at this committee setting or work with each, like what's your pleasure at process?
Mhm.
I'll send you an email summary prior to the next committee meeting, so you have it available to review, so if you have questions.
You might share a copy of that.
Sure.
So what, they're concerned with the hospital. So I'd like to see, what are they making with the hospital, what are they asking for?
So I don't know.
So we can have that.
You know what might help, I have access to the electronic, union agreement, the current one. I can email that to everybody, because it's really easy to time, you just look at the grade and then figure out what the steps is.
It is and it isn't.
Right, it is correct, because the grade 20 and the scheduled WCCH and the collective bargaining agreement, which is what I crashed course myself on this last night, is what the starting pay for clinical nurses are in both the acute care setting and the clinics. And if I'm getting this wrong, please correct.
No, I think you said.
On the inpatient clinical side, they receive a premium if they do shift work or if they take supervisory responsibility. And then they also have an opportunity to advance through the clinical ladder, right? So if they take additional responsibility and participate in PI projects and do trainings, they can advance through the clinical ladder as well. So, part of the issue too is the collective bargaining unit members don't have an agreement. This came up, I think, in the health department because they saw some postings that are coming through. And,
And the printed agreements are not for people to look at, okay?
so
So you would take that scale and then depending on who they are and how they advance the clinical ladder, that's how you would, okay.
yeah, so the range could be grade 20, step 1, all the way up to the top of the third clinical. I think there's 3 clinical ladder, up to the top of the third clinical ladder, and that is a significant spread. So it's not as clear as it might seem.
Plus shift differentials,
That's right.
bonuses.
So, if you take supervisory, if you get, if you pick up shifts, or like the opportunity to make significantly more money is there,
Yep.
depending on the initiative and the willingness of the employee to do extra. So it's not, it's
I
transparent.
got it.
Right, it's just not.
It's not,
You have a few tries to apply, depending on that's what we're there, right?
I think it's frustration. And there's some. Not to other areas.
These are valued colleagues, and I've not talked with any of them about this, but it's brought it to me yesterday. I understand the frustration, and I would appreciate the committee's, here on it.
Yeah, I think we could, but maybe that will help. Swing things out a little bit.
Okay, thank you for the data.
Anything else coming before public go? If not, we're adjourned.